can take out of it and take it forward. So Himali ji, over to you, please.
Thank you so much, Rajeshji. So I'll just try to make my presentation brief, and then we'll just keep a more open session for question answers and discussions, because I'm sure there'll be a lot of questions at the end of it. So basically, I'll start with the purpose of this seminar. Why are we having this seminar in the first place? So what we want to do is understand Rotary's Global Grant. I'm sure there are a lot of senior Rotarians here, so they know what Global Grant is. But just want to go over how we use Rotary's Global Grant to apply for the Lifter project. Second part of the seminar would be how can you qualify your club or district to receive a global grant in areas of organ donation and transplant. And the third is I'm going to explain the Lifter project that has been the signature project of our club and the first project in the history of Rotary International to receive a global grant for transplant surgeries. So that is going to be the purpose of our project. Now, everybody likes stories. All of us still love stories, especially when a story has a good ending. So our project, Lifter project, also started with a story. And that is the story of Kamini, a 21-year-old girl from a small city of Dahod in Gujarat. And she was suffering from end-stage liver cirrhosis. So when her father is a very poor, they're a very impoverished family. The father is a driver at somebody's house and the mother is a homemaker. So when her condition started deteriorating, they took her to Mumbai to show some doctors. And that time the doctors told her that she had only about 2 or 3 months to live because her condition had worsened so much that there was no hope that she would survive. And after that, they came back to Dahod. But unfortunately, I don't know how it happened. Nobody told her. In Bombay, the doctors didn't talk to her about live liver donation. They just told her about deceased liver donation. That means getting a liver from a person who is dead. So they told her if you register for this liver donation, deceased liver donation, it might take you about maybe 6 months, 9 months down the road to get a liver. And by the time, obviously, she didn't have time. She didn't have that much time. But no doctors told her about the fact that somebody from her own family could donate a part of their liver and save her life. And then our charter president, Anil Srivastava, as many of you know, he goes around, he's been spreading the word about organ donation, not only in India, but throughout the world. And his mission is to unite Rotary for organ donation. So during one of his trips, he was passing through Dahod and this girl's father, Kamini's father, saw his van with all the organ donation posters. So he approached him and he asked him, what is this all about? So when Anil explained to him what is this, he said, can you come to my house? My daughter is suffering from some liver problem, which I don't know about. And doctors have given her only 2 months to live. So Anil went to their house and he met them. And then he came to know about the problem. And he said, that somebody from your family can donate. And that's how the conversation started. And the mother was ready to donate. She was found to a match, but the problem was money because they were very poor. So Anil did some crowdfunding. They flew the girl to Bangalore and she had a liver transplant. Now that girl is doing very well. She's a nurse and employed in a hospital. So that's how the whole idea for Lift Up came about. And that's when Anil got the idea that, we can, funds should not be an obstacle for somebody to live or for somebody, for any of us to save somebody's life. And that's how the Lift Up project was born. So I'll explain what the Lift Up stands for. It's an acronym, but I'll just come to that later. So first we come to why we chose kidney disease. Why not any other organ transplant? Why we chose kidney transplant? So these are the ground realities which our research showed. So when we decided to go for organ transplantation, we did a lot of research. A lot of our members who are doctors, transplant surgeons, we did a lot of research. And this is what we came out with. So these are the ground realities of the kidney disease in India. That it is very rampant. Over 7.8 million, that is 78 lakh people are living with CKD, that is chronic kidney disease in India. And that number is increasing day by day. Kidney transplantation, it is associated with catastrophic out-of-pocket expenses. In big cities like Mumbai and Delhi, a kidney transplant can cost you anywhere between 10 to 20 lakh rupees, which is well beyond the means of a middle-class family also. There are a lot of government schemes, a lot of state governments are giving schemes or compensation, but they do not support transplantation because compensation may be something in the order of 2 or 3 lakh rupees, but that does not cover the transplantation cost. And if they are available, if government schemes are available in some states, the aid package is very low and it does not cover the entire cost. So again, the financial burden is on the families to put up with that additional money that they have to put up for a transplant. So what are the other ground realities we found during our research? That government hospital in two-tier cities and rural areas, there is no medical expertise and infrastructure to carry out a organ retrieval or organ transplant. So they are not equipped to deal with an organ transplant. Secondly, there is a highly medical skill force in urban areas, big cities like Bombay and Delhi, Mumbai, Chennai, everywhere. There is a very highly skilled medical force, but the problem again is of funding because the cost is so high that it is well beyond the means of middle class, lower middle class, or poor families to undergo a transplant. So we do not have a robust public health system or a robust insurance policy to help these kind of people who are living below the poverty line or just above the poverty line. And another very interesting fact that we found from our research was that 84% of the living donors are females. Males are very reluctant when it comes to donating organs to anybody in their family. Forget their wives or daughters or brothers, they're very reluctant. And this we found was more because of societal pressure, traditional and cultural stereotypes, and sense of responsibility toward families. So often females are coerced into donating the organs, saying that it's your duty as a wife, as a mother, as a sister, as a daughter to donate to your family member. So this was a very glaring disparity that we found, that often females are subjected to this kind of a pressure and not males. So when you start any global grant project, especially a humanitarian global grant project, what you need to do first is a community assessment. That is a requirement by the RI or the Rotary Foundation to do a community assessment, because you have to show there is a need for that kind of a project to take place. So you have to prove the need. So for the Lift Up project, we did a community assessment. So in that community assessment, we interviewed about 10 to 15 nephrologists, about 40, more than 40 transplant coordinators, social workers, people who are directly working with people, patients suffering from kidney disease, and more than 100 patients who are on dialysis or who are in advanced stages of chronic kidney disease. So what we found from that community assessment was that 46% declined kidney transplant. So 46% of the patients, they declined kidney transplant owing to financial burdens. They knew that kidney transplant was imperative for them. It was important to save their lives, but they just didn't have the funds to undergo a transplant. So that was a very sorry situation, that they had to deny the right to live just because they didn't have enough money to go through a transplant. Secondly, what we found from our findings is that women's healthcare needs are not being met as much as the men in the family. Men in the family are traditional, especially in lower income groups. We found that men are often seen as breadwinners of the family. So if something goes wrong with a male in the family, that male will always be given a priority as compared to a female, because a female member of the family or a girl child is often considered as a disposable asset in the family. So her health or her needs are not given so much priority as that of a male. This was one other disturbing finding that we found. And children, mainly girl child, are often neglected because of economic constraints. So if there's a male child and a male child will be given priority for medical treatment as compared to a girl family. And this we found was happening more in lower income families rather than middle class or upper middle class families. So now we come to the Lift Up. So we did the community assessment. This is what our findings were. Then we thought of doing this project. So Lift Up is basically an acronym for Life Increasing Funded Transplant for the Underprivileged. It also means, it's got a double meaning. Lift up means you lift up a hope, you lift up a family, you lift up a patient. So it's Life Increasing Funded Transplant for the Underprivileged. What was the aim of our project? What did we start with? So aim of our project was to address the problem of high cost of kidney transplantation for BPL, that is below poverty line, and APL, that is above poverty line, women and children. And this project, it enables beneficiaries with low income group to undergo kidney transplant surgery. And the Rotary area of focus, as we all know, there are 7 areas of focus that Rotary has. So for us, the area of focus is disease prevention and treatment. Now, here a very important part comes, that a lot of people ask us, why did we only select women and children? Like I said in our community finding, like I mentioned, that 84% of the women are donors. And secondly, their needs are often neglected compared to their male counterparts. And that is why our idea of selecting women and children was to show that as Rotarians, we feel that all people, irrespective of their gender, have the right to live. So whether it's a woman, a child, or a male, everybody has a right to live. And that is why our focus was mainly on women and children. We wanted to, along with helping these poor, economically disadvantaged women, we also wanted to show that we do not believe in this gender disparity and everybody has a right to life. So now comes the most important part of any global grant project is the budgeting. How do you do a budgeting of the global grant project? Now, budgeting is always done for us in this project. It was done, how we started was that once we decided to do the free kidney transplant surgeries, we decided that we wanted to do the project in Bangalore because most of our members are based in Bangalore. So we would have the manforce, to carry out the power to carry out the project in Bangalore. In other cities, we were all dispersed. So Bangalore, we have maximum members. That's why we zeroed in on the city of Bangalore. Plus, Bangalore is known for its medical treatments and hospitals and the kind of care that is meted out to patients. So that's how we selected on the city. Then we started off by, our members started approaching different hospitals to get a package for kidney transplants. So we went to about 4 or 5 hospitals and we got the package for kidney transplants. And from then on, we started negotiating with the hospitals to get the best package possible. So we talked to different hospitals. We told them what our purpose was and why we wanted to do this charitable work. So we asked them to give the best possible package they could, cutting all the cost and all that. So the best package that we got was from Manipal Hospital in Hebbal. So they gave us a package of 6.5 lakhs per transplant. Now that package also included post-transplant care, which was very important to us because for any global grant project, they want to see the sustainability of the project. You just do a project and finish it off is not enough. You have to show that the project has got a long-term impact. So we wanted to see sustainability. And that's how we negotiated with them to give us a 3-year post-transplant package where all the doctors who are involved with the patients, they waived off their consultation charges for 3 years. So they will be seeing all the patients for the next 3 years, but they will not be charging a single penny. Plus all the beneficiaries, they will get their test and investigation that is required of post-transplant at very subsidized tests, at very subsidized rates. And thirdly, we also negotiated with some pharma companies to give subsidized medications to our beneficiaries, further reducing their financial burden. So this is how we worked out. If you can see, I will share this PPT if anybody is interested. So you can see how we have broken down the budgeting. So first we started off with doing only 7 transplants because RI told us that they will only approve a pilot project wherein they will allow us to do 7 transplants. So we started with 7 transplants. And you can see with 6.5 package. So how much the cost is. Then post-operative care is of course 0 because we negotiated with the hospital. We had to keep some money for contingency in case some emergency arrived. Then we have a club. We appointed a special project coordinator from our side who would be like a liaising person between the hospital and the club, and who will be following up with the beneficiaries and who will be following up. Whether they are going for follow-ups, whether there is any problem, counseling, guiding, all that. So the project coordinator who is working with us right now, she is also a kidney donor. She has donated her kidney to her sister 3 years back. And she's a single mother of 3 children. So in that way, we are helping her also, overcome her financial problems. So she's our project coordinator right now. And then we had to allocate some money for awareness. So first we thought we will not be able to get beneficiaries very easily. So we decided to keep some money aside for radio ads. So it was going to serve 2 purposes: to bring about awareness about this project, and secondly, to get beneficiaries. But we should have known this before, that in India there is no dearth of people wanting money. So we never had to resort to radio ads. People just, when they heard of the project, via people started approaching us. And we were able to get 7 beneficiaries just like that without even giving a radio ad. So I will talk about this later. So the money that we allocated for the radio ad, we diverted it back into the pool of the project, and we were able to do a 8 beneficiary. So this is called a scope change. They call it scope change in global grant. So I'll come to that later. And of course, the doctor consultation charges and all that, which initially in our budget we wrote as 84,000, but then the doctors were all very gracious enough to waive that charges also. So again, that went into the pool and funded our 8 beneficiaries. This is how we have raised the money for the global grant. Like I said, our founder president Anil, he has been Go back to the. He has been going around the whole world. So he has a lot of connects. Like Sharadji already said, he knows a lot of people, not just nationally, internationally. So he was able to talk to different districts, different Rotarians, and raise the funds for our project. So our budget was 70,377, and we were able to raise 70,377 US dollars by DDFs, that is district designated funds from 4 districts, by individual contributions from Rotarians and non-Rotarians, and also from clubs. So this is how, and in any global grant project, is very important to match the budget with the funds raised. You cannot have excess or you cannot have less than that. So we had a budget of 70,377. We were able to raise 70,377 US dollars. So I'm just going to give you a brief overview of the Lift Up project. So total of 8, at the end of the project, we were able to help 8 economically disadvantaged female beneficiaries. All of them had willing living donors. So they were all live donations, and all of them had living willing donors. The project offered free renal transplant surgery, plus free doctor consultation for 3 years, plus subsidized follow-up test and investigation for 3 years post-transplant. And the club has negotiated with pharmaceutical companies to offer post-transplant medication at subsidized rates for all beneficiaries, further reducing their financial burden. These are the names and the ages and the donors of our beneficiaries. So they are all 8 of them. I'm not going into the detail, but these are the 8 beneficiaries. So now we come with the most important, the qualification requirements. How do you qualify for a global grant? How does your club qualify to become a qualified club? So most important thing for any club to qualify for a global grant is your district. Every district has a grant management seminar towards the end of the year. So it is very important that at least one member, all of you know as Rotarians, that every club has a foundation chair. So it is very important either the foundation chair or at least one member of the club attend this grant management seminar organized by the district. So a note is made by the district as to who is attending from the club. Only if a member of your club has attended that grant management seminar can your club be qualified to apply for a global grant. So it is very important that one member attend that seminar. So many clubs ignore this grant management seminar, but if you're interested in the global grant, it is very important that you make note when your district is having the grant management seminar and send at least one, preferably your foundation chair. If not possible, at least one member should attend. Then complete all the MOUs. MOUs are all the things that you're going to complete with your partnering organization or partnering club. And it's very important that your club is current on all RI and district dues. If your dues are not paid either to the RI or the district, your club will not qualify for a global grant. All these checks are done by the RI before even approving your application for a global grant. Thirdly, the club must be current on all reporting of. So if your club has already applied for a global grant, is already carrying out a global grant project, it is very important that your reporting has to be completely done. Whether it's a progress report or final report, your reporting has to be done for all the current or ongoing global grant projects. And the club's average per capita contribution to the TRF annual fund of $40. Okay, so this is also very important. Many clubs do not contribute to the TRF's annual funds. They will not qualify. So even if your club is small, you do not have that much money, it is very important to contribute to the TRF's annual fund just to qualify for a global grant. And the president-elect of your club has to enter the foundation goals on the Rotary Club Central. This is very, very important. So I am the now president-elect from July 1st. So I have already made sure we have applied for a second global grant, which is called as Lift Up 2.0. So before applying, I made sure that all the goals of my club are entered into the Rotary Club Central, because this is also checked by the RI. So this is the checklist that you need to qualify as a club to apply for a global grant. Now, how do you go about the application process? So you can start your global grant application by going to myrotary.org. All of us as Rotarians, especially the presidents and secretaries, have myrotary.org. You enter your password, your username, and you enter that. And then you go to the grant center, which appears on the home page. You go to my grants, and then you apply for a grant, and you start your application there. So till your application is going on, till you're filling the application, it stays in the draft section of the application. Now, a community assessment and sustainability plan are key parts of the application. So you have to have because we are talking about a humanitarian project, which is like a youth project, it is very important to have a community assessment and a sustainability plan. Like I explained before, like you have to show the long-term impact of your project. Then you have to work with your DRFC, that is the District Rotary Foundation Chair, or the assigned liaison. Like the TRF, the Rotary Foundation also assigns you with an officer who will work with you for during this application process. So that so after you have submitted the application, you will know who is assigned to you, and if there are any problems, queries, concerns, that person will keep getting in touch with you. They will try to find out from you why you are doing this, how you are doing this. If there is a problem somewhere, they will tell you to rectify it. So, and even your district foundation chair can help you because they have a lot of experience in doing these kind of projects. So wherever you are stuck, even in the application process, you can ask them how to go about it, what you can write, what is the right way to put across, or what is the right way to put in the application. So these are things are very important. So being, with your, on what do you say, being in constant touch with your district Rotary Foundation chair is very important for a global grant application. And you schedule a presentation to the grant committee or be prepared to answer queries or concerns. Like I said, the TRF will give you a assigned officer. So they may raise a lot of queries. Like for the first lift up, we were almost going back and forth with our assigned officer for almost 5 months, from September to January, before 4 months before our application approved. For 4 months, we were going back and forth with that officer because she had so many queries and she was coming up, and her seniors were raising queries that how can you do this and how can you do that, and how you will be able to sustain, or how you will be able to complete the project in such a short time, things like that. So you have to be prepared. So your homework has to be done so well that you are able to answer, because they don't wait. Once a query comes in, you have to reply within 2-3 days, and then they start processing. The more you delay, the more your processing gets delayed. So all this homework has to be done beforehand by the club, and especially the person who is preparing the application or who's in charge of the application. So what are the terms of qualification? So this global grant that you receive, it is valid. The funds that you receive are valid for 1 year. In the sense, once you receive the funds, within 1 year, you have to start using them. You cannot wait that the funds are come. Now we'll do the project after 2 years. No, it has, once the funds are coming in, you have to start using them within a year's time. The club is responsible for the grant fund. So it's its club's responsibility, not only the person who has applied for the global grant, but it is the liability is on the entire club to make sure the funds are utilized in the most appropriate way, and the way you have mentioned in your application. You cannot say one thing in an application and use the funds in some other way. The third, the club must disclose conflicts of interest. For example, I'll just give you an example. Like in our project, suppose you are doing a lift up project with a hospital, and 2 of your members are working in that hospital only. Then it is a conflict of interest. So you cannot have a hospital where your members are already working there. So that is called as a conflict of interest, or they should not be benefiting from that grant fund. Also, suppose your 2 doctors are in the transplant team and they are only doing the project, and they're going to earn out of that. They're going to get a salary from the hospital from that grant amount. So that is called conflict of interest. So that should not happen. So that you have to be very, very careful, because if that happens, then you will not get approved for the grant. So you have to declare that there is no conflict of interest whatsoever. The club must cooperate with all audits. The audits may come, and audits may come from the TRF. It may come even from the international partner or the international club who's partnering with you. They also have the right to ask you questions, to ask for the accounts as to how the money is being spent, because according to TRF's mandate, they are also supposed to oversee the implementation of the project. So the audits, you have to comply and be very transparent with your utilization of funds. The club must use the grant funds properly and implement the club MOU or bids disqualified. The club MOU is generally between the club, the partnering hospital that you are going to partner with, or the organization you're going to partner with, and with the international sponsor. It is called as a memorandum of understanding between organizations. So this is what the MOUs are. So you have to honor that and implement that. So whatever terms and conditions are stated in the MOU, those have to be honored to the T. So community assessment for the grant application. How do you do a community assessment for the grant application, especially a humanitarian project like a lift up? I am talking mainly about the lift up. Different humanitarian projects will have different community assessments. My mandate today is to talk about the lift up. So the application of community assessment should highlight the data on any specific group. For example, for the lift up, our specific group of patients suffering from kidney diseases you plan to impact. So who are you trying to help? The patients with kidney diseases and who require transplant. So your assessment should highlight the data on those. Like I just said, we did the community assessment and we found that 46% didn't want to go through transplant because they didn't have enough funds. Then a community assessment results form should include. So you have a proper form that you have to fill. That is also given by the TRF. It's a standardized form which you have to fill. A community assessed results form should include complete answers indicating details such as Rotarians doing the assessment. So who are the people involved in doing the assessment? The name and roles of the professionals in the hospital that have participated in the discussion and when the conversation or assessment took place. So for example, in our community assessment, we had 8 nephrologists who participated. So we had to give the entire, who are the nephrologists, which hospitals they were associated with, what were their contact addresses, what were their contact details, all that we had to state. So to prove that, it was a genuine assessment. And a formal community need assessment is required for all global grants that I have mentioned. And I'm mentioning it again and again, because for a humanitarian project without a community needs assessment, you are not likely to get a grant. Not likely means you're not going to get a grant at all without a community assessment. So international participation with, as we all know, especially clubs who have applied for a global grant, an international partner or sponsor is required for every global grant. So basically, international partner or sponsor is a club which is outside the country, project country. Okay. So in same way, for any humanitarian project also, you require an international sponsor or a partner who is a club which is outside your project country. So our project country was India. So we had to find an international sponsor. For our first lift up project, our international partner was a club from Australia, that is Rotary Club of Osborne Park. It's also a small club, but they agreed. Again, it came through our charter president, Anil, who was traveling through Australia spreading organ donation awareness. And he met the club's president and he told him about the lift up and he became very interested. And he said, whenever you need my help, let me know. So when we applied for the global grant, we approached them and they immediately agreed to become our international sponsors. Now, there is another concept which is known as notional international sponsor in the TRF. So what is a notional international sponsor? A notional international partner is a international partner who does not give any funds. Normally, any international partner, when you have an international partner or sponsor, they are supposed to contribute funds to your project. But a notional, when you are getting a directed gift, when your project has a directed gift coming from any Rotarian in your district or outside your district, then the international sponsor is not required to give funds. They are known as notional international partners. Sorry. So basically, a notional international partner is somebody who does not have to contribute any money. Okay, now as described in the terms and conditions of the grant, at least 15% of all contributions to the global grant that fund humanitarian projects need to come from the outside the project country. For example, our budget was of 70,000 US dollars. So 15% of that 70,000 we had to raise from outside the country through Rotarians, through Rotary clubs, which belong outside to India. So this is very important for all humanitarian projects. 15% of the contributions to the global grant has to come from outside the project country. The funding source needs to be adjusted by the sponsors to reflect that. So basically, when you are making a budget, you have to make sure that whatever your budget is, your 15% has to come. So when you are making a budget, you have to be very sure that your 15%, you will be able to raise that 15% from outside India. And then only you can make your budget. And TRF calculates 15% for all contributions. That means 15% of all the, so 15% is what is of all the entire contributions that are coming, the total contribution, 15% of that, which is excluding the World Match Fund. So I'll explain what that World Match Fund is when we go ahead. Now, after you have done the budgeting, you have, you're already talking to clubs who are likely to give you money. So before you have to make sure you have already started your dialogues with clubs and different districts. Okay, how much will you give me? How much will you pledge? How much, this is how you make your budget. Depending on that only you can start making. So once you know, okay, I'm likely to get so much money, then only you will plan your budget. Now, once you start the application, what do you have to provide with the global? So just filling the application is not important. You have to provide duly signed MOUs. If working with other organizations, it's obviously in a project like Lift Up, you are going to work with a hospital or a dialysis center or whatever. So you need a proper MOU that has been duly signed by the relevant authorities. You have to provide a specific timeline for the execution and conclusion of the project. For example, for our Lift Up, we had given a timeline of 1 year. That once our project starts, within 1 year, we will finish all our beneficiaries. Confirm the number or names and roles of the members involved in the implementation committee. So for the Lift Up, when we had to give all the names. So who will be in the implementation committee? Who will be in the screening committee? Who will screen the beneficiaries? How many members will be involved in the screening committee? How many members in the implementation committee? How many members in the overseeing committee? So all that you have to give the TRF with the names of all the members who will be involved. So this is also very important. So they have an idea of how many and which Rotarians are involved. And the host grant committee should be formed with Rotarians who are local and close to where the project was implemented. Like I mentioned before, why we chose Bangalore? Because our maximum number of members are in Bangalore. So we knew that those members are local and they will be able to oversee the project. I cannot be sitting in Ahmedabad or I cannot have maximum members in Ahmedabad and do a project in Bangalore when I know I have only one member in Bangalore and he will not be able to oversee the project. So that is why it is very important that you have to select a project where maximum number of Rotarians from the club can be involved and who are close and who will be locally involved in that project and be able to oversee the project. Now, the most important part is sending the contributions to your F. Okay, now you have approached all the clubs, you have approached all the districts, they have pledged, like for example, I come to Rajesh Ji's club and say, okay, how much will you pledge for my next term? He said, okay, we'll give you $3,000. Now he has pledged. That way, many clubs have pledged, but he cannot send the contributions right away. You have to wait till your global grant application has been approved. If you do not wait, if the contributions are sent only at the application stage, then those contributions are non-refundable if your project gets rejected. If your application is rejected, then that funds will not come back to you. They go into the World Fund. So it is very important when you're talking to clubs and Rotary districts about contributing, you just get them to pledge. They do not have to, even Rotarians for that matter, individual Rotarians or non-Rotarians, they have to wait until the application has been approved. Once the application has been approved, then if you have, like everybody has seen, there is on our Rotary page, we have the donate, we have the donate subsection. So they have to go in the donate, when there is a drop-down list. In the drop-down list, they will see a global grant. They have to click on global grant. When they click on global grant, there will be a global grant number. So when you make an application, the TRF assigns a global grant number to you. They have to put in that global grant number and then they have to send the money. That, okay, we will send 3,000, we will send 2,000. So all that contribution has to come at a later stage after the application has been approved. So as stated in the terms, grant and conditions, sponsors shouldn't send contributions before a grant is approved. Very, very important. If not approved, the contributions will be credited to the annual fund share and cannot be relocated. They will not come back to the club or they cannot go back to the global grant, or if the club applies for another global grant, they will not be relocated. So it's very important that your application gets approved before your individual Rotarians, clubs or districts start contributing money. All global grant contributions are irrevocable and non-refundable. Once the money is given, it's given. Contributions exceeding the pledged amount or sent after the grant is paid will go to the World Fund. So suppose we need, say, $5,000 and some club has given $6,000, then that 6,000, they will not refund back 1,000 just because you need 5,000. That 6,000, that additional 1,000 will go into the World Fund. So that is also very important when you're talking to the clubs who are contributing to your global grant. You have to make sure that they will only give the amount of money that has been pledged. If approved, sponsors should work closely with the payment coordinator to prevent overfunding and loss of funds. So what are the common mistakes that most global grant applications we see? Incorrect signatures on the MOU. Sometimes the signatures are forged. Sometimes the MOUs are not perfectly drafted. Now, I have to mention one thing, that the MOU between participating organization is a standardized MOU which has already been made by the TRF. You don't have to make a MOU. It is already there by the TRF. You just have to fill in the details. So you have to use the template that TRF provides. If the application, in the application, failing to state what Rotarians are doing towards a project. So it is very important that you specify the roles of the Rotarians that are involved in the project. If you fail to do so, then the application will not be approved. Failure to ensure that budget and financial information in the application is correct and balances. So your budget and your financial, the funds you're going to raise has to be correct and it has to match. You cannot make, like for example, for a lift up, we had to submit and say how we thought this was the most competitive rate. Like I cannot say that we are going to pay 12 lakhs per transplant when I know that some hospital will give me the transplant for say 7 lakhs. So you cannot give false financial information to get more grant money. That is a fraud. So you have to be very careful that you have to be very transparent and very precise with what you are mentioning, especially the financial details. Failure to upload all documents that are required for closure. So there will be a list of all the documents that you have to upload, and you have to be very clear. If some documents are not uploaded, the TRF gets back to you and tells you that, okay, this document will need to verify. So all those things have to be very precisely done. And like I said, whatever queries or questions are raised have to be replied very promptly and very precisely. You can't beat around the bush and say, okay, I don't have this document. Can I give this document? No, it doesn't work like that. Whatever is required, you have to submit. So that is my presentation. If we just keep the forum open. If anybody has questions, I hope I was able to explain everything, whatever we have done for this project. And like I said, we have already applied for a second global grant, which is called as Lift Up 2.0, where we will be doing 5 additional transplant surgeries. So it is basically a replication of the first Lift Up. But this time we are only doing 5 because it was almost end of the year. We were not able to raise so many funds through DDFs and all that. So we have only done 5. But in the coming Rotary year, we are planning to do a much bigger one.